Welcome to Orange County Chiropractic Car Injury Clinics, and let me share with you how we help relieve disc bulge pain, disc herniation pain. So how that works is first thing we do is we go through an evaluation process, and usually these disc bulges and disc herniations pains are typically the result of either major trauma or minor trauma. Major trauma is like a car accident, a fall, a sports injury, things like that. Minor trauma is something that you do every day, and eventually it just kind of wears out and breaks down. So those are the typical two causes of why we'll see a disc bulge or a disc herniation. Now here's what we do to help relieve disc bulges and disc herniation without surgery and without strong medication with strong side effects. So let me share with you how that works. So the first thing that we'll do is we will consult with you to get an idea of what happened. How did this happen? And the more information we can figure out how it happened, the more it gives us an idea of really what's involved. Next is we will do a range of motion study. We'll see exactly what you can and can't do. Now the reason we do these different tests is it helps to find, it's several reasons. Number one, it tells us what anatomy is involved. It tells us the severity of the anatomy involved and exactly the anatomy that's involved. That's why we do these different tests. So we'll check the range of motion to find out exactly which range of motion is painful and restricted, so we can apply the proper therapy to help decrease that pain and increase that range of motion. Number two, we will do a muscle test. And when we do the muscle test, we'll test for pain and weakness. And what that does is it tells us exactly which muscles are involved, which ones are not involved, and to what degree. And when we know that, then we know what therapy to use to help that specific muscle pain. See how that works? And then we'll do nerve test. We'll do reflexes, dermatomes, things like that, and check for the nerves, see what nerves are involved. That becomes very important. So we want to know exactly what nerves are involved, which nerves are causing the pain. And again, that becomes important so we know which type of therapy to use. Because remember, there's different therapies for different parts of the anatomy. In other words, there's some therapies that are way more effective for nerves. Some therapies are way more effective for muscles. Some therapies are way more effective for joint dysfunction or range of motion, you see. So it's real important to find out exactly what's involved, what anatomy is involved, and to what degree, and where is it. And not only tells us what the problem is, it also tells us what therapies we need to use specific for that condition. And then so that's the consultation, that's the range of motion, that is the muscle test, that's the nerve test. We'll do joint test. And part of the joint test is not only evaluating the joints of the spine, the back and the neck, but evaluating the discs, the spinal discs. And what we'll do there is we'll find out which discs are involved, how much they're involved. That tells us a lot. Now, sometimes, and a lot of times we'll do at least 2 to 4 x-rays to see on the inside what we can't see on the outside, so that becomes very important. That helps us also to show us how the bones are moving. So we'll take what's called stationary x-rays, but we'll actually have you move forward, take the picture backward. That becomes very important because we know when your spine doesn't move in certain areas, we know that's a problem. We know that's going to cause pain and cause problems. Which for us, it helps us to know what area to treat and what type of therapy to treat, you see. So that's the orthopedic test. That's the x-rays. Now, on occasion, now not all the time, but on occasion, we'll do an MRI. Now, you don't have to do an MRI for every suspected disc bulge or disc herniation. So it depends on how severe it is, how much else is involved. So it really depends on the degree of the disc bulge or the disc herniation. But if necessary, we'll send you out for an MRI to see exactly what's going on with the disc from that perspective. Okay, so we do all these tests. Now we have a really good idea of a lot of things. We know how it happened. We know the anatomy involved. We know if we're dealing with not just the disc, the nerves, the muscles, the tendons, the ligaments. All that tells us exactly which therapies we need to use to help decrease your pain and restrictions and decrease the muscle spasms associated with it. And a lot of times with discs, and especially if you have a disc bulge or a disc herniation, it's real important that there's what's called some form of decompression, and chiropractic physical medicine is really good for that. There's multiple ways of doing it. There's very gentle ways. There's some ways that are a little more firm. So it really depends on how sensitive you are as a patient, but it can be very, very gentle. Highly effective, by the way. It's highly effective. We have tremendous results treating, helping patients who have disc bulge, disc herniations, and actually, we've helped a lot of people, prevented them from having surgery and permanent problems. So, but these are the way. This is how it happens. Now, once we know the problem, the degree of the problem, the severity of the problem, on where the problem's at, and how much is involved with the different tissue. Okay, now we do the appropriate therapy. So, are we going to do therapies specifically for disc? Are we going to do therapies that affect the nerves, therapies that affect the muscle, therapies that affect the joints or your range of motion? You kind of see how this works there. And it all depends on those findings. So then we go ahead and treat you, depending on what we found. Now, the new patient special includes 3 chiropractic treatments if we feel that we can help you. So immediately, we're going to know in the first, second, or third treatment, how much relief we're going to be able to help and how fast we're going to be able to help it. Pretty fast. And typically we see a lot of quick results fast, to be honest with you. Almost all the time, most of our patients feel some degree of relief on the very first treatment. That's a very high percentage. The degree of relief varies on the patient and how severe their problem is, things like that. And it also includes 3 pain relief therapies to help decrease pain and muscle spasms. So you get 3 chiropractic treatments, 3 pain relief therapies that help decrease the pain and muscle spasms. Now, typically, all of that costs $350 or more. Now, with the new patient special, it only costs $97 unless you have car insurance. If this problem was due to a car injury, then you don't need the new patient special. It's covered 100%. Your car insurance will cover it 100%. If it was a workers' compensation injury, it's covered 100%. We accept that also. If it's major medical, we accept all major medicals. So we'll accept those. And if you are cash, we accept Medicare. And if you're a cash patient, just use our new patient special. So we make it easy for you to come in, get treated, see how quickly we can start helping you, get you back on the road to recovery. We do offer 2 guarantees. If for whatever reason you're not satisfied within the first 72 hours, you get 100% refund. Number 1. Number 2 is we have what's called a 7-minute wait policy. What does that mean? It means that when you schedule your appointment, you will see one of our doctors within 7 minutes. That's what it means, which is unheard of in medicine. And so you will not have to take off a half a day or a full day to come in and see us. That's not going to be the case at all. You'll be able to come in the morning, afternoon, or evening, because we'll be open as early as 9 and close as late as 6. So you won't have to take off work. And when you do come in, it's only going to take about 20 to 30 minutes. So you will not be in our office for 2 or 3 hours. And when you come in, you'll see the doctor within 7 minutes. So we're pretty efficient. In other words, we're going to respect your time. That's what we're going to do. Okay? You trust us, we're going to respect your time. So again, this typically costs $350 or more. With the new patient special, it only costs $97. Give us a call. So if you're having disc bulge, disc herniation type of symptoms, or you feel that what you may have, or maybe you've seen another doctor and they said that's what you have, give us a call. We can help you. High likelihood we not only can help you, but we can prevent surgery and decrease the likelihood of you having a permanent problem to some degree the rest of your life. We see and help and treat disc-related conditions pretty much every day. So give us a call. Again, it's Orange County Chiropractic Car Injury Clinics right here in Santa Ana, California. And you can reach us at 714-617-5858. That's 714-617-5858. Now remember, when you call, there's a good chance we'll be able to get you in that day, like right after work. You call, we'll get you in right out. Good chance we're going to be able to get you in right after work that day. And if not that day, the very next day. So we're really good about getting in and helping to get you to feel better as fast as possible. Okay? So again, it's Orange County Chiropractic Car Injury Clinics right here in Santa Ana. Give us a call. We feel very confident we can help you. And by the way, ask for the new patient special when you call. It's only $97 and it includes everything I just talked about. Give us a call. We look forward to helping you.